Hi, this is Metma. I'm gonna do the part B of the question that was asked on the discussion in this video. First, I'm gonna go ahead and talk about the figure 11.5. In the figure 11.5, it shows the structure and the function of the conduction system. It talks about heart's electrical conduction system that controls heartbeat and ensures heart pumps blood in a coordinated way. The sinoatrial node, SA node, in the right atrium, it is also known as the heart's natural pacemaker. It starts with the electrical impulse that triggers the heartbeat. The impulse travels through the arteriovascular node, which is also known as AV node, uh, and it sits between atria and ventricles. The AV node briefly delays the signal, giving ventricles time to fill with blood. The signal then moves to the AV bundle called bundle of His, which carries the impulse into right and left bundle branches. These branches carry signal down the septum to the Purkinje fibers, which spread in the signal throughout the ventricles. This causes ventricles to contract and pump blood to the lungs and the body. In the same figure, they have a EKG, and let's talk about the purpose of the EKG. In the image that shows EKG tracing, that graph shows how the electrical activity changes over the time. The P wave represents arterial depolarization, which is when the atria contract. The QRS complex shows ventricular depolarization, which is when the ventricles contract. The T wave represents ventricular repolarization, which is when ventricles relax. In some people, a U wave follows, uh, possibly showing polarization of the Purkinje fibers. Each wave reflects part of the cardiac cycle, helping doctors diagnose heart conditions. Abnormalities in this system can cause arrhythmias like arterial fibrillation or heart blocks. For example, if the SA node fails, heart may beat too slowly, a condition called bradycardia. If the ventricles don't contract properly, it may lead to ventricular tachycardia or even an cardiac arrest. The EKG is a simple, non-invasive tool used to detect these problems and monitor heart health. The second figure that I'm going to talk about is going to be figure 11-6A. In figure 11-A, it shows a balloon angioplasty. A balloon angioplasty, which is also called percutaneous transluminal coronary angioplasty. This minimally invasive procedure opens narrowed or blocked coronary arteries caused by plaque buildup, a condition known as atherosclerosis. In the first step, In the picture that is labeled as A, a catheter is inserted through a large blood vessel, often the subclavian artery, and guided into the coronary artery. The catheter has a balloon and at the tip, which is shown on the B of that figure. And once the catheter reaches the blockage, then the balloon is inflated, which has shown in the C of there, pushing the plaque against the artery wall. And it shows that in the D in that figure. On the part E, it shows how it widens the artery and allows blood to flow more freely. In 11-6, a stent is a tiny mesh tube that was often placed to keep the artery open permanently and prevent re-narrowing. That is shown on the F of that figure. This procedure helps restore blood supply to the heart muscle, reducing chest pain and angina and the risk of heart attacks. So on figure 11-6, there's a part B to it. So let's talk about the part B in here. Coronary bypass surgery. The second part of the figure B shows coronary artery bypass grafting or CABG. This is a surgical procedure used when angioplasty is not enough, especially in a severe blockages or multiple blocked arteries. A healthy blood vessel from the legs, venous vein, or chest internal mammary artery is used to create new path or bypass around the blocked coronary artery. This bypass allows oxygen-rich blood to flow to the heart muscle beyond the blockage. The purpose and the importance of these procedures. Both procedures aim to restore oxygenated blood to the heart muscle. Blocked arteries can starve heart tissue, leading to myocardial infarction, heart attack. These treatments are life-saving and help prevent heart failure and cardiac arrest. Citations: Colbert B. Ankley, J. and Wilson, J. 2011, An Integrated Approach to Health Sciences, Anatomy and Physiology, Math, Chemistry, and Medical Microbiology. Synergy Learning, US, https //full-bookshelf vitalsource.com /books 9781133418498 498 links to an external site. Bonavit West, K. Hunt, S.A. and Applegate, E. 2020, Medical Assisting, Administrative and Clinical Procedures with Anatomy and Physiology, 6th edition elsewhere.